Hello, everybody. I want to thank Sam Scarpino for accepting the interview. Sam is an assistant professor of marine, environmental sciences, and physics at the College of Science of Northestern University in Boston. Sam is a complex systems scientist who investigates topics that include network science, human behavior, and infectious disease modeling. Thank you very much, Sam, for accepting the interview.
Thanks for having me, Carlos.
Okay, Sam, are you in quarantine right now?
Yes, we've been working out of our houses in my lab for a number of weeks now, both out of an abundance of caution, but also because individuals who have the privilege to work from home should do so, because lots of other individuals don't have the ability to work from home.
All right, yeah, I'm also here in my apartment. So I have this question. A lot of people remember what were they doing exactly when 9/11 happened. So maybe in the future, people would remember exactly what were they doing the first time they heard about this COVID-19 epidemic. Do you remember what were you doing the first time you heard about this?
I was thinking about that question and also the 9/11 question, because there are, of course, a lot of individuals who are alive today that were not alive during 9/11. And so I remember 9/11 very, very vividly, and was in high school working on an AP English paper that was due that day. And my friend called me and said, I don't think the paper is going to be due. There's been this plane crash. And I told him that I'd call him back after I finished the paper, because I was so stressed out about that. And I think you're right that this COVID-19 is going to be in our memories in the same way. Because of our work on infectious diseases, I heard about this cluster of unexplained pneumonia in Wuhan quite early, just about exactly when it was sent out over the news wires. And I remember we were on vacation during the holidays and immediately started having conversation around whether this was something that was likely to cause a pandemic, or whether this was more like diseases, SARS and MERS, that would be controllable before it spread.
And when did you suspect? I suppose it was way later. When did you suspect that this would go out of control, and why you suspected that?
It actually wasn't that much later. It was, mid-January, mid to early January, and I could go back and find out exactly when it was, because it was a conversation that I had with a professor at Johns Hopkins, Caitlin Rivers, on Twitter. There were reports of human-to-human transmission of this virus in Wuhan, and I made a comment on Twitter that I thought the evidence wasn't strong yet that it was human-to-human transmission. And I got a message from Professor Rivers, who said that she really felt that there was good evidence that there was efficient human-to-human transmission, and I should really take a careful look at this again. And I think then very quickly we understood, in the coming hours and days, that this had been spreading rapidly in Wuhan and was a really big risk for our global society.
So this year you have published an important paper in the journal Science called "The Effect of Human Mobility and Control Measures on the COVID-19 Epidemic in China." Can you tell us a little bit about your main results?
We started that paper for two reasons. The first is I'm a part of a large international effort to record individual level case data on COVID-19. We've entered almost 100,000 cases. We have people working all over the world in every language where there are cases of COVID-19. And when we saw what was happening in China, it was so unprecedented that they were going to put a cordoning off around 14 million people in Wuhan. That's something that we never imagined would happen. We wanted to understand how that affected the transmission of COVID-19. And what we ended up discovering in the process is that the mobility restrictions, the borders that they imposed, they were implemented too late. The virus had already spread all throughout China and escaped outside of China. It was the local measures, the behavioral measures, physical distancing, smart work, the closing of non-essential businesses that really brought the outbreak under control. And this was an important message now because so many other governments are trying to understand how to respond. And there's a lot of pressure to close borders. And one of the things that we understand quite well epidemiologically is that closing borders really doesn't do very much unless the cases are very, very low and you have an effective measure for screening. But the economic and societal consequences of border closures are very, very high. And so we should really focus on physical distancing, testing, case isolation, because those work. And although they have a high economic cost, it's much, much less than border closure.
All right, so these social isolation measures that we're having right now in Colombia, they have a scientific background, right?
They do. There's evidence in China, South Korea, and Italy that these measures work. We also know that it's economically very challenging, especially for individuals that are in the most marginalized and at-risk groups in our populations, which is why it's so important that the government support those people in every possible way that they can. But I think it's also important that every single one of us understands that the mental and social toll of isolation is really hard, even for people that have a comfortable life economically. And we need to do everything we can to support each other as we're going through the coming weeks and months.
I had a question. So this social isolation that you hear all the time is to flatten the curve, but if this you sudden, so the idea is to give time to science to come up with an antiviral or a vaccine?
There's two reasons that we're interested in flattening the curve. One is to try and buy as much time for a vaccine or an antiviral, although I think at least on the vaccines, the most realistic timelines I've heard are early in 2021. The other reason that we're interested in flattening the curve and pushing out the epidemic peak is to reduce the demand, the simultaneous demand on the healthcare system.
Yeah.
And depending on where you live, you might not have as much access to the hospital system that you need. So I know in the US, for example, and I'm sure the same is true in Colombia, that most of the hospital resources are concentrated in the cities, but you still have lots of individuals that live outside of the cities. And flattening the curve is going to help prevent the city hospitals from becoming overwhelmed and also buy enough time for the cities to prepare to help the rural areas that are going to have less access to resources.
And therefore, potentially, the isolation period should be longer than what you hear, like 2 weeks from now, right?
I think there's a reason that we keep hearing 2 weeks, 2 weeks, 2 weeks. So in Italy and China, South Korea, from the time they implement the measures until the peak of the cases is about 3 weeks. And then it's probably another 3 or 4 weeks after that before the cases are low enough that you can start to bring back some of the old ways of moving around and relaxing some of the measures. So I think probably a more realistic timeline is from the day you put in the measures until we might start to relax them is more like 5 or 6 weeks.
Okay. Sam, you did a PhD together with me in the University of Texas at Austin. You did your study with Mark Kirkpatrick. He's a famous population geneticist, and also with
Lauren Myers.
Lauren Myers.
Yeah, that's right.
So you know a lot about population genetics. So related to that, how the DNA sequences of the virus can help us to understand the contagion networks and prevent new cases?
Starting really with the 2009 H1N1 pandemic, one of the new tools that epidemiologists had available to them was the sequencing of pathogen genomes. And in 2009, that was mainly used to understand where the outbreak originated from and how the virus had recombined between avian, pig, and human lineages to create this virus that causing the pandemic. Then in 2015, an Ebola outbreak in West Africa, we used the genomes of the Ebola virus to try and reconstruct the transmission chain of who infected whom. Right? So you imagine that if I have Ebola and transmit it to you, it would be hard because we're remote. But if that happened, you would see the mutations that the viral genome that I was carrying had. It would accumulate some mutations in you before you passed it on to someone else.
Mm-hmm.
And the pattern of those mutations, essentially reconstructing the phylogenetic tree, the evolutionary relationship, allows you to estimate what that transmission chain looks like. And for COVID-19, there's been a huge international effort to sequence the genomes of the virus, track its spread as it moves around the globe, try and understand the local transmission dynamics. How fast is the virus spreading through the population? But also be able to put people's fears to rest that the virus is mutating or picking up, new changes that increase its transmissibility. We can show very convincingly that it's picking up new mutations at random, exactly as you would expect for a coronavirus. And there's no evidence that, it's being shaped by natural selection to increase transmissibility or that the virulence is changing. And that, of course, is a really important message for the public to understand that there's no evidence that this virus is mutating to become more deadly or transmit more quickly.
And I assume that evolutionary biology has an important role here, right? Because you can potentially study what parts of the virus are like evolving faster, and you can...
Absolutely. So a lot of the methods that we use to study the genomes are taken right off the shelf from evolutionary biology, estimating the mutation rate, estimating the length of the evolutionary branches in the tree that the virus is on, trying to understand how it's related to other coronaviruses that we're familiar with, like SARS and MERS, but also the coronaviruses that cause the common flu. And so that's been one major part of this outbreak is, the evolutionary geneticist, evolutionary biologist very quickly teaching us about the history of this virus and how it's been moving around the globe.
One of the things that make COVID so hard to contain is that asymptomatic people can spread it, and also there's not enough testing. How your models account for this, or how can a model account for this?
It turns out that we didn't know until relatively recently that you had lots of asymptomatic or pre-symptomatic transmission. There was evidence early on that some individuals were asymptomatic, but it was not clear how common that was or whether they were able to transmit the infection to other people. Over the past few weeks, a number of publications, including one from Lauren Meyer's group at the University of Texas at Austin, showed very convincingly that you have both a high fraction of individuals who are either asymptomatic or the symptoms are so mild that they don't notice really that they're sick, and that individuals can transmit the infection either before they have symptoms or during the course of one of these asymptomatic infections. As you might imagine, that's part of the reason that this is such a difficult disease to contain, because screening for temperatures, plenty of people will walk through the temperature screens. They will not have a fever, they will not have symptoms, but they will be infected with COVID-19 and they could transmit. That's another reason that the physical distancing and the isolation of individuals is so important. We saw in the United States that one of the senators, Rand Paul, went to the gym at the Senate while he was waiting on the COVID test, which is very dangerous, because if you're waiting on the test, that means you could already be infectious and you need to be at home isolating yourself so you're not potentially exposing other people. So how do we incorporate this into the model? Well, one, we need to have equations in the model or parts of the computer simulations that allow for a period of time when an individual is asymptomatic and then so would not be caught by the healthcare screening systems, but could transmit the infection. We also need to then advocate for things like antibody screening and serosurveys to retrospectively see what fraction of the population was actually infected, because especially in places like China, we're really only seeing the symptomatic cases. In terms of the testing, in many countries, especially the United States, the testing rates were so low that we were probably only finding 1 in 10 or 1 in 20 of all of the cases, which means that our models had a huge amount of uncertainty in the possible size of the outbreak. And unfortunately, when you're in that situation, there's not a whole lot that you can do besides communicate how uncertain we are and communicate the importance to policymakers around increasing the rates of testing, because that will increase our certainty about the situation and give us more information to intervene effectively, flatten out the curve, and then also try and restart the economies efficiently after we get through the first waves.
How much more do we know about this disease than a month ago? Like some specific things.
It's been pretty amazing to watch how quickly the scientific community has learned about this virus. So we literally didn't know it existed 3.5 months ago. As I mentioned at the beginning, that this was discovered because it was a cluster of pneumonia cases with an unknown cause. So we didn't know what was making these individuals sick. Very quickly, the virus was isolated, its genome was sequenced and put online by the Chinese government. We developed molecular tests. We started studying the epidemiology. As I mentioned, we learned that it was asymptomatically transmitted. We learned about the effects of social distancing, physical distancing, case isolation, testing. We have the antibody tests. There's vaccines that are already in early stage safety trials, the screening of antibodies. It's really almost every week the amount of information that we have about this virus doubles. Now, of course, there's two issues with that. One, we've also learned that a lot of the things that we thought a month ago were wrong. And so, 5 or 6 weeks ago, most of the models didn't include the asymptomatic or pre-symptomatic transmission. We now know that that's an important and critical component of the models. So the landscape of our understanding is evolving very, very rapidly. The other is that, of course, also creates opportunity for fake news to gain a foothold because the science is changing so quickly. Individuals can easily kind of hide the truth of some of the things that they're putting out there, which is why it's very important that we're continuing to speak with the journalists, that we're speaking in social media to keep the public informed about exactly what is the current knowledge around this virus and this outbreak.
The last question, this is a hard question, but maybe you adventure to answer it. How do you think is going to be the future, like a year from now? Some people say that nothing is going to be the same. You believe that, or?
I think that it's true that nothing is going to be the same. About a month ago or so, I was still talking about returning to normal, and I've tried very carefully not to say that anymore, because I know that all of us are experiencing trauma, even if we don't realize it, because of the stress that we're going through. Even those of us that have privilege to be safe and healthy and have food on our table, even those individuals are incredibly stressed. And so that trauma is going to mean that our societies will be changed forever as a result of this experience. I do think that over the coming year, especially before there's a vaccine available, we're going to be dealing with controlling this outbreak and balancing the economic effects. It's one of the reasons that we're spending quite a bit of time now studying the mobility patterns of places as they implement measures like remote work, the closing of non-essential businesses, closing of schools. We need to really understand exactly how interventions like school closure changes the way we move and connect with each other, and how that affects the viral transmission, so that in the next few months, we can decide which of these measures we can start relaxing to best balance the economic effects, the mental health and social health effects, with the need to prevent the reintroduction, or at least make the reintroduction of COVID-19 much less likely, or to provide protection to the most vulnerable parts of our communities, especially those individuals that are at highest risk of severe disease or death.
Well, Sam, thank you very much for this interview. You have been very kind to give us some time to answer these questions, and stay safe there.
Thanks so much, Carlos.
Okay.